We talked about the Health and Retirement Study, which is a large survey that's being done at the University of Michigan, funded by the National Institute on Aging, and we've been following folks who are 50 and older since 1992, trying to understand the relationships between health and wealth and how it affects families and social programs like Medicare and Medicaid. And what we were talking about specifically today was what's happening with brain health, is sort of the general term, or how well are people thinking, how many people are getting Alzheimer's disease and dementia, and is that changing over time? So we were trying to compare between the early 90s and later in early 2000s, is the population getting healthier from a brain perspective or less healthy? And that's what we've been trying to study. So we found that it seems as though between those two time points, brain health in the United States actually seemed to improve. So people in the later years were scoring better on our cognitive tests than earlier in the early 90s. And we think a couple things are going on. One is that there's been a big increase in the level of education that older folks in the United States have attained. So people who were 70 and older in 2002 had on average about 1 additional year of education compared to the folks in the earlier times. And we think education is quite important in keeping your brain healthy. Still trying to understand exactly how it does that, but we think that was one of the important changes over time that might have improved brain health. Another is the question of how well we're treating important cardiovascular risks, especially high blood pressure and high cholesterol, which we think have a negative impact on the brain, just like they have a negative impact on the heart. And the treatment of hypertension has become increasingly aggressive during this time period, and I think our conclusion is that that's actually been an important, good thing for people's brains. So one of the interesting aspects of this health and retirement study is that there's been studies that have been started in upwards of 20 countries now around the world that have similar studies that are patterned on the health and retirement. During this time period in the early 2000s, people are more likely to get treated for high blood pressure here in the United States, and we think that could be one explanation for why we seem to be to have more cardiovascular disease, but for this specific issue of treating high blood pressure, we seem to be doing a better job in the United States, and that might be helping to protect the brains of older folks in the United States compared to those in England. Again, one of the other nice aspects of the health and retirement study is that the data are free, that these are data that we're basically funded in order to collect this large amount of data and make it publicly available for people to use. We try to get it used as widely among different kinds of researchers. So, certainly it's not data for every kind of research, but for people that want to do these studies of epidemiology and health economics and other factors. These are data that are waiting to be used, and you don't have to spend the time and money to collect them yourselves.